Hello dentist, how are you today? I hope you're fine. Today we're going to talk about infection control. Before we start our topic today, I want you to subscribe to my channel and hit the notification bell for more videos. Today we're going to talk about several things. We're going to talk about what is infection control, the definition of infection control. Then we're going to talk about the routes by which infection is transmitted in a dental practice. And then we're going to talk about the importance of hand hygiene in dental practice. And then we're going to talk about the items or the equipments that should be cleaned between each patient in the dental clinic. And finally, we're going to talk about the difference and the reason behind the difference in infection control procedures, which you should employ in dental practice when treating patients with HIV and no known blood diseases, and what is the difference. Okay, so let's start our topic now. We're going to talk about what is infection control. It's a series of measures to prevent the route of transmission of pathogens. So for the pathogen to pass into the human body, it goes through a certain or passes through a certain route or transmission, a route of transmission. Okay, so so we have to interrupt this route of transmission, in order to prevent the passage of pathogen into the human body. Let's look what are we going to do in the next slide. We're going to talk about the routes by which the infection is transmitted in dental practice. This is really important to know the different types of routes and types of transmission. Let's talk about the first one. Transmission could be done direct or indirect. So the transmission could be direct contact or indirect contact with the patient. Example: viruses like herpes, varicella zoster, hepatitis viruses, respiratory syncytial virus. If we have bacteria, it could be methicillin-resistant Staphylococcus aureus. The second type of the route of transmission is parenteral transmission, which is via bloodstream. The viruses that cause such diseases, example hepatitis V and hepatitis D, immunodeficiency virus. Okay, human immunodeficiency virus. So this is the second type, parenteral transmission via bloodstream. From the third thing is the transmission via airborne, through the air, and respiratory secretions. So the bacteria used here, in case of bacteria, through airborne or respiratory secretions, tuberculosis, and in case of viruses, influenza, severe acute respiratory syndrome, or coronavirus. Okay, so we talked about the routes by which infection is transmitted in dental practice. It's very important to know this. This is really important. Okay, let's go to the next one. Infection prevention and control. Of course, hand washing is very important in dental clinic. Hand hygiene should be carried out at, when do we wash our hands? Okay, at the beginning and end of each treatment session, before donning personal protective equipment, and after removing the personal protective equipment, after washing of dental instruments, before contact with instruments that have been steam sterilized, whether or not these instruments are wrapped, following cleaning or maintaining decontamination devices used on dental instruments, following completion of decontamination work. Okay, so these are the time when we have to wash our hands or make hand hygiene in the following time. The following items should be cleaned between patients. So it's very important to clean these items between each patient, from patient to patient, okay, in between visits. Here we say the dental chair should be cleaned, okay, with alcohol. Okay, we make decontamination. Okay, So the dental chair, local working surfaces, this is really important between patient and patient. Curing lamps, okay, inspection lights and handles, of course, because you use the handle with each patient's. Hand controls, including replacement covers, trolley, delivery units, spittoons, okay, should be washed, okay, this is very important. Aspirators, X-ray units. So this is really important to know the items that should be cleaned between patients, okay, these items should be decontaminated, okay. Finally, we're going to talk about infection control for patients with HIV and not a known blood-borne disease, okay. So in such cases, we have to, in our dental clinic, we have to treat all patients the same way. So we have to make our precautions in order to know. Maybe some people, they come to the clinic and they don't know that they have HIV or they have a certain blood disease, hepatitis B or C, whatever. So we have to make our precautions, universal precautions, employ universal precautions. So anyway, we have to make precautions. Either we know that this patient has HIV or we don't know. So in case we know or we don't know, okay? So we have to make our precautions in any way or in any case. You enhance the patient's trust by occasionally pointing out the precautions used in the surgery. Example, use the disposable items, so we can use the disposable items. Sealed single use items like anesthetic cartridge, newly sterilized handpieces. Okay, so this is really important. In this case, I want you to read more about this this question. This question is an exam question, okay, and I want you to read more about it and we will try to make another video for it and try to read it more in details, okay, to know exactly how what should be done in the clinic for such precautions, okay. Thanks for listening, and I hope that today's topic was of interest to you, and hope to you all the luck, and I'm sure it will be useful for you in the dental clinic.